Based on these results, we need to consider...
Have you ever watched a doctor realize he crossed a line he could never uncross? Johns Hopkins Hospital, November 12, 1949. Dr. William Harrison thought he was giving medical advice. What happened in that hospital corridor would haunt him for the rest of his career. If you love discovering the untold stories behind music history's most incredible moments, please like this video and subscribe to our channel. Johns Hopkins Hospital, Baltimore. November 12, 1949. 2:30 p.m. The sterile smell of disinfectant filled the air as Billie Holiday walked slowly down the hospital corridor. Her breathing was labored, each step carefully measured. The doctors had told her the damage to her lungs was getting worse. Years of performing in smoke-filled clubs, years of stress, years of carrying pain that went deeper than any X-ray could reveal. She was here for her monthly checkup. Another round of tests that would tell her what she already knew. Her body was breaking down. The question was how much time she had left. Nurse Patricia Williams walked beside her, clipboard in hand, trying to match Billie's careful pace. Patricia had been working this ward for 8 years, and she'd never met anyone quite like Billie Holiday. Most patients complained constantly about their conditions, demanded special treatment, made the nurses' jobs harder. Billie did the opposite. She asked about the nurses' families, remembered their names, treated everyone with a kindness that seemed to glow brighter the sicker she became. "The doctor will see you in just a few minutes, Miss Holiday," Patricia said as they reached the waiting area outside the pulmonology department. "Take your time, honey," Billie said, settling into one of the hard plastic chairs. "I'm not going anywhere." But as Patricia walked away to file some paperwork, Dr. William Harrison emerged from his office. He was 45 years old, chief of pulmonology, and one of the most respected doctors at Johns Hopkins. He'd graduated from Harvard Medical School, done his residency at Massachusetts General, and built a reputation as a brilliant physician who could diagnose conditions other doctors missed. Dr. Harrison had been treating Billie for 6 months now, and every visit left him more uncomfortable. Not because of her condition. He'd seen worse lung damage before. It was something else. Something about the way she carried herself, the way she talked about her music, the way she refused to acknowledge that her career might be killing her. "Miss Holiday," Dr. Harrison called out as she sat in the waiting area. "Could I speak with you privately for a moment?" Billie looked up from the magazine she'd been reading. "Of course, doctor." Dr. Harrison led her to a small consultation room off the main corridor. The walls were bare except for his medical diplomas and a chart showing the respiratory system. He closed the door behind them and gestured for her to take a seat. "Miss Holiday," Dr. Harrison began, pulling out her chart. "I've been reviewing your test results from last week." Billie waited patiently as he flipped through pages of medical notes and X-ray reports. "Your lung function has declined another 12% since your last visit. The scarring is progressing faster than I'd hoped." He looked up at her over his reading glasses. "I'm concerned that if you continue performing, especially in the environments where you typically work, you might be shortening your life significantly." Billie nodded slowly. She'd heard variations of this conversation before. "How significantly?" she asked. Dr. Harrison set down her chart and leaned forward. "Miss Holiday, I'm going to be very direct with you. If you continue performing in smoke-filled nightclubs, continuing the stress and strain of your current lifestyle, you might have 2, maybe 3 years left." The words hung in the air between them. Billie's expression didn't change. "And if I stop performing?" she asked quietly. "If you retire now, move somewhere with clean air, reduce your stress levels, avoid secondhand smoke entirely, you could have 10, maybe 15 years. Dr. Harrison waited for her response. Most patients, when faced with this kind of choice, didn't need time to think. The decision was obvious. But Billie was quiet for a long moment, staring at a point somewhere beyond his shoulder. "Dr. Harrison," she said finally, "what do you know about my music?" The question caught him off guard. "I'm sorry. My music. What do you know about it?" Dr. Harrison shifted uncomfortably in his chair. "Well, I know you're a very successful jazz singer. I know you're quite famous. I know you perform at some of the most prestigious venues in the country. Have you ever heard Strange Fruit?" Dr. Harrison's jaw tightened slightly. "I'm not sure what that has to do with your medical condition." "Humor me," Billie said. Have you heard it? I've heard of it. Yes. But you've never listened to it. It wasn't a question. Dr. Harrison's face flushed slightly. Miss Holiday, I don't see how your choice of repertoire relates to your lung function. Billie was quiet again, studying his face. Doctor, in your medical opinion, what's killing me? The scarring in your lungs. The reduced oxygen capacity. The strain on your cardiovascular system. But what caused the scarring? Dr. Harrison flipped through her chart again. Years of exposure to cigarette smoke in performance venues. Possibly some early childhood respiratory infections. Environmental factors. Environmental factors, Billie repeated slowly. That's an interesting way to put it. Something in her tone made Dr. Harrison look up from the chart. What environment do you think I grew up in, doctor? Dr. Harrison was quiet. Baltimore. Fells Point. You know that neighborhood. Dr. Harrison had heard of it, but he'd never been there. It wasn't the kind of place doctors from his social circle visited. Poverty. Violence. Hunger that made you forget about everything else. Billie's voice was matter of fact, like she was reading from a medical chart. I was prostituting myself by the time I was 13. Not by choice. By necessity. Dr. Harrison's face went pale. The men who hurt me, the men who used me, they didn't care about my lung function. They didn't care about my long-term health prospects. She paused. You want to know what started damaging my lungs? Fear. Constant, relentless fear. The kind that makes you hold your breath for hours at a time, waiting for the next blow, the next violation, the next reminder that your life doesn't matter to anyone. Dr. Harrison set down her chart. This wasn't the conversation he'd planned to have. Miss Holiday, I understand you've had a difficult life, but do you? Billie interrupted quietly. Do you understand? Dr. Harrison didn't answer. Tell me about your childhood, doctor. I don't see how that's relevant. Humor me, Billie said, echoing his earlier words. Dr. Harrison was uncomfortable, but something in her eyes made him answer. I grew up in Connecticut. My father was a doctor. I went to good schools. I had every advantage. Did you ever go to bed hungry? No. Did you ever fear for your physical safety in your own home? No. Did anyone ever tell you that your dreams didn't matter because of the color of your skin? Dr. Harrison was quiet. So when you tell me that my music is killing me, Billie continued, what you're really saying is that speaking truth about my experience, about the experience of people like me, is a luxury I can't afford if I want to live longer. Dr. Harrison opened his mouth to protest, but Billie continued. You're telling me that if I stop singing about lynching, if I stop singing about poverty, if I stop singing about the things that damaged my lungs in the first place, then I can have more years to live quietly with my pain. The room felt smaller now. Dr. Harrison could hear the sounds of the hospital outside. Nurses walking down corridors, phones ringing, the distant sound of medical equipment beeping. Normal sounds. But inside this room everything felt different. That's not what I meant, Dr. Harrison said. What did you mean? Dr. Harrison realized he didn't have a good answer. He'd been treating Billie's symptoms while ignoring their causes. He'd been focused on her lungs without thinking about what had damaged them. He'd been offering her more years of life without considering what kind of life those years would be. Dr. Harrison, Billie said quietly, if I stop singing Strange Fruit, what happens to the people who need to hear it? I'm not sure I understand. Last month after a show in Chicago, a young woman came up to me. Black woman, maybe 25 years old. She told me that hearing Strange Fruit was the first time someone had acknowledged what had happened to her brother. Dr. Harrison was listening now, really listening. Her brother was lynched in Mississippi in 1947. 22 years old. The local police ruled it a suicide. No investigation. No justice. No one would even say his name. Billie paused. She told me that hearing that song made her feel like she wasn't crazy for being angry. Like her brother's life had mattered to someone. Dr. Harrison was quiet. So when you ask me to choose between my lung function and my music, you're asking me to choose between my life and her sanity. Between my breathing and her brother's memory. The weight of what she was saying settled over the room like smoke. There are thousands of people like her, doctor. People whose pain has never been acknowledged. People whose losses have never been mourned. People who need to know they're not alone. Dr. Harrison looked down at her medical chart. Numbers and measurements and test results that suddenly seemed inadequate to capture what was really at stake. Your song, he said quietly. It's about more than music. Everything is about more than it appears to be, Billie said. Your medical advice isn't just about lung function. It's about who gets to speak and who has to stay silent. It's about whose life is considered worth preserving, and whose truth is considered worth suppressing. Dr. Harrison felt like he was seeing his patient clearly for the first time. Not just the damaged lungs and declining test results, but the woman carrying the weight of speaking for people who had no other voice. What am I supposed to do? Dr. Harrison asked. Ignore your medical condition? Pretend that your performing isn't making you sicker. I'm not asking you to ignore anything, Billie said. I'm asking you to understand what you're really asking me to give up. She stood up slowly, her breathing still labored, but her posture strong. I know I'm dying, doctor. I've known for years. The question isn't how to make me live longer. The question is how to make the time I have left count for something. Dr. Harrison stood up as well. Miss Holiday, I took an oath to do no harm. If I don't warn you about the risks. You've warned me, Billie said. Now you need to trust me to make my own choice about what risks are worth taking. She walked toward the door, then stopped and turned back. Doctor, can I ask you something? Dr. Harrison nodded. When you go home tonight, when you sit down to dinner with your family, will you tell them about our conversation? Dr. Harrison thought about his wife and 2 children waiting for him in their comfortable house in Roland Park. Would he tell them about Billie Holiday's choice? Would he explain why a dying woman had chosen to keep singing songs that hurt her lungs? I don't know, he admitted. Think about why that is, Billie said quietly. Think about what it means that this conversation feels too uncomfortable to share with the people you love most. The door closed behind her with a soft click. Dr. Harrison stood alone in the consultation room for several minutes after she left. Her medical chart lay open on the desk, full of data that told only part of her story. Declining lung function, reduced oxygen capacity, shortened life expectancy. But nowhere in the chart did it mention the young woman in Chicago whose brother had been lynched. Nowhere did it document the people who found healing in Billie's willingness to sing about pain. Nowhere did it calculate the value of speaking truth to power. When Dr. Harrison finally left the consultation room, he walked past the waiting area where other patients sat reading magazines and waiting for test results. Normal people with normal medical problems that could be solved with normal medical solutions. For the first time in his career, Dr. Harrison wondered what it would be like to treat patients whose problems couldn't be separated from the society that had created them. That evening, Dr. Harrison did go home to his family in Roland Park. He did sit down to dinner with his wife and children, and when his wife asked about his day, he found himself telling them about Billie Holiday. He told them about a patient who was choosing to die faster in order to live more fully. He told them about a woman whose music was literally killing her, but whose silence would kill something even more important. His wife listened quietly. His children asked questions he couldn't answer. What would you do? His daughter asked. If you were her doctor, what would you tell her to do? Dr. Harrison was quiet for a long time. I don't know, he said finally. I honestly don't know. 3 months later, Dr. Harrison attended a Billie Holiday concert at the Royal Theatre in Baltimore. It was the first time he'd ever heard her perform live. When she sang Strange Fruit, he understood for the first time why she was willing to sacrifice years of her life to sing it. The song didn't just describe lynching. It created a moment of shared witnessing, a space where the unthinkable became undeniable. For 3.5 minutes, everyone in that theater had to confront a truth they'd prefer to ignore. Dr. Harrison watched Billie's breathing during the performance. He could see the strain, the effort each note required. He knew what it was costing her. But he also saw the faces in the audience. The tears. The recognition. The way people reached for each other's hands during the most difficult verses. After the show, Dr. Harrison went backstage. Billie was sitting in her dressing room, exhausted, oxygen tank beside her chair. Dr. Harrison, she said when she saw him, did you enjoy the show? I understood it, he said. Billie smiled. That's better than enjoying it. They talked for a few minutes about her breathing, her medication, small adjustments to her treatment plan. But when Dr. Harrison stood to leave, he paused at the door. "Miss Holiday, I owe you an apology." "For what?" "For thinking medicine was just about bodies. For not understanding that healing sometimes requires speaking truth that hurts." Billie nodded. "We all learn what we're ready to learn, doctor. The question is what we do with the learning once we have it." Dr. Harrison carried that conversation with him for the rest of his career. He became known among his colleagues for spending extra time with patients, for asking about their lives beyond their symptoms, for understanding that medical treatment couldn't be separated from social reality. When other doctors asked what had changed his approach to medicine, Dr. Harrison would think about that day in the consultation room when a dying woman had taught him that some things were worth sacrificing years to preserve. He never forgot the question Billie had asked him, "What happens to the people who need to hear it?" And he never forgot his own inability to answer. Because sometimes the most important medical advice a doctor can give has nothing to do with medicine. Sometimes healing requires choosing truth over comfort, voice over silence, meaning over mere survival. Sometimes the patient teaches the doctor what it really means to do no harm.